Good morning, I'm Lisa Galligan-Dawson, Cancer Services Manager.
Simon Hargreaves, ENT Consultant and Clinical Lead for Cancer.
We've been asked to talk to you a little bit about the last 12 months in cancer services. In 2013-14, we actually failed to achieve all of our targets in Q3. So there's obviously been a big focus on moving things forward and making those improvements in this year. And the outcome of that is that we've managed to achieve all of our targets for all 4 quarters, which is great news for both the Trust and our patients. And we've actually been able to improve both of our regional and our national positions, and that's through the work across the whole of the Trust.
We're both relatively new in post, having been appointed within the last 12 months, and between us we've forged quite a strong management and clinical relationship. We have good open communication with joint goals, ambition for the service and a joint approach to problem solving and change management. Janet Keegan has recently been appointed as the new clinical lead nurse. We see this as a vital appointment and really providing us with the missing dimension and provide a really focused leadership for cancer.
We've brought down how we've achieved some of those improvements into a couple of key areas, communication, teamwork, and how we've focused on key areas of initiatives. So from a communications perspective, individual work across the Trust with clinicians, nurses, diagnostic services to really micromanage patient pathways and to try and separate the mass of patients from those that are really causing us concern and problems and focusing on getting those patients through their pathway in the most timely manner possible. We have an improved relationship with the CCG. We have some joint working with both the lead GP and the elective care lead commissioner, and we meet as a group on a bi-monthly basis. So that's to address concerns and to try and make improvements in both primary and secondary care. Better working relationships with the tertiary sites. So we know that a lot of our patients actually get treated outside of this Trust. So we've improved the working relationships with the tertiary sites so that we can more effectively manage those patients and their treatment across the patch. We've done that through site visits, getting to know the teams and having a point of contact in each area. And part of that has been linked in with the work through Manchester Cancer. There's a clinical leads meeting that Simon goes to, a cancer managers meeting that I attend, and then we both attend the Trust Leads meeting, and that'll be something that Janet comes along to as well. And that's really to bring all of those dimensions together and to forge those working relationships. And that's proved really beneficial for us and our patients. We've also got a cancer workshop and the internal Trust Leads meeting, which has a really good attendance and gives us a good baseline for problem solving.
From a teamwork perspective, there's definitely a perception within this Trust that all clinical services, nurses, clinical nurse specialists, clerical and support staff all pull in the same direction with a clear focus on problematic issues and trying to solve them. Last 12 months we've concentrated on trying to focus on particular aspects of patient care, particularly the tracking process, tweaking the reporting process, focusing on the 1942-day rather than the 62-day targets, and of course concentrating on the front end of the pathway, getting patients into hospital within 7 days as opposed to the obligatory 14 days. Which is a relatively easy hit. Of course, all of this involves a huge amount of discretionary effort, and within that lies one of the key challenges here, which is maintaining the level of discretionary effort within the Trust, such that the answer one often receives when presenting colleagues with a problem is yes, let's get this sorted out. Of course, there are additional challenges moving forwards, particularly with regard to both diagnostics and therapeutics, particularly in the context of there being nothing but increasing demand moving forwards. And this is going to be a key challenge for the future for us all. Thank you.